we expect, I don't think anybody in this room is prepared to lose a tooth if given a choice. They would like to keep the tooth. And therefore, specialist dentistry has increased a lot. And we'll talk and cover what that means at a later point. So part of the holistic is not just that they're getting a cascading layer of care. If somebody needs something more, we are able to actually get one of our team members to actually help that patient. Aesthetic is part of that. Now, one of the reasons probably a lot of you are here are things like amalgam replacements, so which we'll be covering later on. The other one is people who are very nervous, very anxious, and will actually do almost anything not to go to a dentist. But when they do come in, it's your duty to ensure that you are able to understand what their needs are and see what you can do to help them. And the last one is, of course, keeping teeth for longer. A lot of patients have the habit of clenching and grinding. And in London, I would say safely 70% of my patients clench and grind easily.
Do they know they do it?
Most don't. Most don't. The moment the first I say, they just look at me twistly.
And you can tell?
Yeah. I have a magic ball. I think it's the way they come into the surgery. Kick the door in. I have to say. Yes, exactly. So, no, but I think that's a big one. And therefore, a lot of these patients will hold a lot of tension around the head, neck and shoulder regions as well because of that. Especially if they've got a descending problem. So as well. So I hope that today's chat about holistic dentistry will tell you a bit more about what a dentist can do and what a dentist cannot do. Now, this is one of the things where we talk about the right-wing aspect of holistic dentistry, or the extremes, and somewhere over the left or the middle. I'm much more in the middle. Now, just to explain that, health-related professionals are highly regulated in this country. So if I call myself a dentist, I have to act like a dentist. You know, I can't walk like a duck. So I can one cousin. But that's the point. They want you to act like a dentist. So if I start giving you nutritional advice which is affecting your dental health, i.e. sugars, that's fine. But the moment I'm starting to talk about take this nutrition for X, Y, Z, I'm crossing a boundary. Okay? And therefore, for somebody like myself who is not ready to retire and doesn't want to be struck off, so I have to make it very clear to patients that my role is when you come in and say, I want my amalgams replaced, my role is to actually technically see how we can do this for you in a safe way. I will not stand and make claims. You get this done, you will feel better. Okay, the moment I do that, I'll basically sign my resignation letter. Okay? Because that's not, but partly it's because most people have problems which are multifactorial. And to say that it's all linked to amalgam, I personally find that very difficult. There are always different layers to it. Yes, we can investigate this, we can do this, as long as you're prepared that this may not necessarily resolve your problems. Okay, and have you looked at X, Y, Z as well? Okay? And that's very, very important that it's got to be what I call a transparent professional relationship. It must not be a misleading or pressurized one. So, therefore, sometimes we will find when some of the questions you ask me later, I'm not fudging them and I'm not actually trying to avoid them. I'm simply not saying any more about it simply because if I did, I'll be in trouble. Okay? So I think we have to, you know, you guys know enough about mercury, amalgams, toxicity and all the rest of it, and each of us has to make a decision based on that, whether you want them done. And when they want them done, it's my role how to help the rest.